And welcome back here to Open. Suicide is the 10th leading cause for death in the United States. On average, 132 Americans take their own lives every day. Suicide is the second leading cause of death for people in ages 10 to 34. During this time of a pandemic, ongoing community unrest and other traumatic events have undoubtedly affected people's mental health. Joining us now to talk a little bit more about this is the Managing Director of Alquimedez Mental Health Counseling, Henry Montero. And Henry, good to have you.
Thank you for having me on your program.
Thank you. And as I said, obviously Suicide Awareness Month is this month, but this month could not come at a more critical time, particularly for us here in America. We got COVID-19, you've got social unrest, you got, the election that's around the corner. Talk to us about what you're hearing by way of suicide nationwide now.
Nationwide, we're having at least 47,000 people committing suicide or dying by suicide a year in the United States. New York is the state that has the less suicides in the country, which is also great. But at the same time, what we want to try to do is bring down whatever suicide rate at least by 10% each year until we have zero. So that's the goal.
Yeah. And when we talk about it being a goal of bringing it down by 10%, talk to us about, first of all, some signs, because I think suicide is definitely preventable in a lot of cases. Talk to us about what can be done on the prevention side.
On the prevention side, it's always best to ask if the person is suicidal. There should not be any myths or any taboos about asking the question, are you suicidal? Where most suicidal cases are caught on time are in ER, emergency rooms. So most patients, they come in with whatever symptoms of depression or maybe an overdose on drugs. And through that prevention in that scenario, most cases are prevented of suicide.
Talk to me about who are the potential people that are really at risk when you talk about that, because sometimes suicide catches people off guard. We talk about celebrities, and we watch some major celebrities. I can think about Anthony Bourdain and others who you wake up one morning and then you hear they've taken their life. And ultimately, there's a surprise factor there. But to those who work in the industry, they say there's some things that really don't come as a surprise because we missed some signs and we missed some warning flags.
For most people, it's a surprise when you're in general public, but we never know what people are going through in their insides, in their hearts, what they have in their minds. And most of these celebrities, most of them live lonely lives. Some of them, there's sometimes drug use. But what's the major risk is mental health, substance use, and also having a firearm. Half of the deaths in the United States are due to firearms in the home.
Firearms. Wow. Well, I think that when we think about firearms, the automatic thought is somebody else, but then not knowing that people are actually taking their life themselves using the firearms. September is this awareness month. We're talking about suicide prevention awareness. What can people do on the form of awareness?
Well, keep in contact with your loved ones. That's the first one. Go out, seek counseling. If you feel that you want to take your life, call 911. It's the best option out there, and always seeking out counseling, either from a pastor or a psychotherapist or a psychologist. Services are out there. There's a hotline as well, nationwide hotline. That's an excellent source for those people that are at risk.
And we talk about triggers, right? What are some of the triggers that you see that are happening now? And maybe because of societal unrest and what's going on right now, we should also be paying attention to these triggers.
There's a complete unrest in society. People are anxious, people are depressed. There's a lot of people losing their jobs. And when they see themselves without any hope, with losing the little that they have, then they start thinking about things that they shouldn't. So there's always hope out there. There's always a way out. There's always a future to look for. So right now, I know things are a little bit difficult due to the COVID-19, but always try to seek for help. That we're here to take care of you.
Yeah. And Henry, I was glad when you said earlier on in the show that, when it comes to New York, as far as our numbers there, we're doing better than a lot of people across the country. And while we do pat ourselves on the back for that, there's got to be also some keys as to why that's happening. From your perspective, why is it that maybe New York's numbers aren't as great as other places around the country?
Well, the good thing to live in a great city like New York is that we have access. We have hospitals that are less than 1 and 2 miles away. We have a lot of mental health clinics. We have a lot of resources in the city. So we have to say that we're a blessed state. We're a blessed city. We have a lot of people with compassion as well. And I think those are the primary risks, the primary solutions that we have for the people out there compared to other states in rural areas where in order to seek treatment, people might have to travel to a facility of care. So those are the options that compared to other states and New York State.
Yeah. And we know, particularly in communities of color, there's always this aversion to seeking out
Mm-hmm.
counseling and to really looking out and getting help that's actually needed. But talk to us. Do you feel like that barrier is actually coming down, given the fact that all the stuff that we got going on, folks do want somebody to talk to?
Well, then that is an excellent point. Why? Because actually there are more therapists now, there are more psychologists, and more people of color as well taking care of our own. So that gives us a better opportunity, an upper hand to communicate, to emphasize, to understand the struggles that we go through day to day. So I think that is also a plus. That is also an advantage that we have, having people of our own race that actually are able to take care of our population.
Yeah, I mean, but people don't sometimes equate that to be a difference maker. But the reality is, it's a huge difference maker when you have
Yes,
somebody
of course.
that's a minority, and you have somebody on the other side of you have somebody on the other side of the desk or the couch or whatever that actually
Hmm.
sees them.
Hmm.
You know exactly, or you at least you get a sense of feeling that this person at least understands where I'm coming from.
Well, I agree with you 100%. Towards my understanding, there's a huge difference when I go out and speak to a doctor and the doctor is Hispanic or the doctor is African American, and we can empathize and we understand and we could talk about certain things that maybe we wouldn't feel as comfortable speaking to a person from another race. So I think that we need more of Black people, Hispanic, going out and getting those degrees and being able to connect with the population. And there's a huge need. There's a huge population that needs our help.
Yeah. Talk to me a little bit about suicide ideation.
Well, suicidal ideation, it happens a lot with people that are suffering of depression. There's that constant thinking, that constant rumination of what about if I don't exist anymore, if I'm not alive. It has to be taken seriously when someone has a suicidal ideation. But the question that should be asked after that, after knowing if someone has suicidal ideation, is do you have a plan? Are you at risk? What are your thoughts about? And depending on those answers, it's preferable to call 911. And it's always better to get committed in a hospital and go through the process. And then once you come out, when you're discharged, we could start a whole process of counseling. Maybe the patient needs a medication to create a balance on their serotonin levels, and that's completely fine. That's another conversation that we have to have. If there's a need of the use of medication and how effective the medication is. There's also great treatments out there, such as genetic testing to understand what's the best course of medical treatment of medication that could be used for someone that is suffering of depression. So you're not alone. There are treatments out there. There's cognitive behavioral therapy, there's mindfulness, dialectic behavioral therapy, there's medication use. If you want to seek out for a pastor, counselor, there's a whole bunch of treatments out there that can be used for someone that is suffering of suicidal ideations or has suicidal thoughts.
Yeah. Before we leave, I want to give you a chance to give you a quick plug. You be able to share with us a little bit about the work that you do and how people might be able to get connected to you if they're thinking.
Well, you're always welcome to visit us. Our website is www.alquimedez.com, and our phone number is 315-505-2400. And we're open. We do counseling. We got great therapists working with us. We got a great population of doctors also prescribe that are able to prescribe medication. And we work with adults and kids and the older population as well.
Mm. Well, Henry, one, thank you so much for joining us and really sharing in on this conversation. It's great to bring awareness, unfortunately, for a very sad thing that a lot of Americans have to grapple with and deal with, and families, have to contend with. But certainly to be able to bring the information out and explain it has made all the world of difference. Thanks a lot, Henry.
Mm-hmm. Thank you so much.
All righty, thank you. And listen, I want to let you know, if you want more information, don't forget you can visit them on their website at alquimedez.com. Follow them on Instagram. Also follow them on Facebook at Alquimedez Mental Health. We are taking a quick break, but guess what? We do have more open. Stay with us. We're coming right back right after this.